Hello dear student, my name is Dr. Wahidullah. In this video, I am going to discuss with you a scenario question which is based on the measles diseases. A 2 years old child is brought to the OPD with a complaint of high grade fever for last 4 days. He has cough and rhinorrhea for last 4 days. On examination, he is having maculopapular rash on ears and along ear line, spreading to the trunk. Rest of examination is non-specific. What is your diagnosis, investigation, and treatment? So, the clinical pictures given in this scenario, these are high-grade fever, maculopapular rash, cough, and rhinorrhea. Suggest that this is the case of measles. So, before solving this scenario, let's have a look over the measles. That what is measles? Measles is an infectious disease which mainly occurs in the children. This is the diseases of children. This disease rarely occur in the adult. This disease is mainly caused by a virus called RNA paramyxovirus. The incubation period of this disease is 8 to 12 days, and the spread of this disease occurs mainly through droplets. When the patient coughs, the virus is released in the form of droplet. Now, what are the clinical features of this disease? The clinical picture of this disease can be memorized by a mnemonic, that is 3C. In this disease, there is cough, coryza, that is the inflammation of mucosa of sinuses. Flu-like symptoms occur in the patient, and conjunctivitis, which is the redness of eyes. The eyes become red, and along with that, the main pathognomic sign is cough-like spot, which is the grayish white spot on the buccal mucosa. Along with that, maculopapular rash occurs all over the body. These rashes mainly start on the head, below the ear, or on the hairline. Now, what is the investigations of this diseases? The diagnosis of this disease is mainly through clinical history and examination, but we can also go for many other blood tests like CBC, complete blood count, which shows that there is decreased TLC, yani decreased TLC, total leukocyte count. And we can also go for the blood culture and PCR for the viral DNA. Now, what are the complications of the associated with this disease? The complications of measles are mainly due to secondary bacterial infection. The most common infection is complication is otitis media, which is the inflammation of middle ear cavity, and there is bacterial pneumonia, which is the infection of lungs due to which there is cough. And also there is in the severe form there is encephalitis, which is the inflammation of brain. So these complications all occur due to secondary bacterial infection. What is the management? The management of measles is mainly through supportive treatment, that is hydration, IV fluid, and antipyretic for the fever relief, vitamin A supplementation for the redness of eye, and treatment of the complication, that is secondary bacterial infection, through antibiotics. And we can also prevent this disease through vaccine, that is MMR vaccine.